Good morning, Sri Lanka. Welcome to the show on another Wednesday morning. You're here with me, Amaya, and we have a great show lined up for you. Now, we on Good Morning Sri Lanka always want to make your quality of life better. And there are certain diseases and disorders that really do get us down, and one that can really impair all the practicalities in life and, going about your day-to-day life is rheumatism. So that is a disease that we will be speaking to you about today on the show on a Wednesday morning, and I'm sure all of you would like to know more about this disease because awareness really is key in preventing any type of disease, and that's true for rheumatism as well. So I'm not going to be giving you any advice. We have some professionals, some specialists who know what they're talking about, and they're here with us in the studio to give you some advice about what you can do to deal with this disease if you have it, or prevent it if you don't have it. So let me just get on straight to introducing our guests. We have Dr. Harindu Vijayasinghe and Dr. Lilani Parangala and Dr. J.V. Aryasinghe. So good morning, doctors. Welcome to the show.
Good morning.
It's great to have you here, and thank you so much for taking some time out of your schedules. I'm sure that you have so many patients to see and work to do, but you're here with us this morning, so thank you so much for being with us. So let's just get right down to it. If I could ask you, Dr. Aryasinghe, what is rheumatology and what is rheumatism?
Actually, rheumatism is a lay term. It encompasses a lot of rheumatoid arthritis, as well as inflammation of the ligaments, the tendons, and all that is surrounding a normal joint. So there are so many kinds of arthritis. They say more than, some people say 100, maybe about 200, because even other diseases sometimes cause pain in the joints and the back. So they also come under rheumatism as such.
So all of these things are part of what we laymen call rheumatism, but there are so many other diseases that come under it, is it? Dr. Vijayasinghe?
Yes.
If you could elaborate?
Yes. Actually, rheumatism is an older term. We call this rheumatology and musculoskeletal diseases, and they involve disease of our joints. Now, a joint is the place where two bones meet in our body. For example, yes, we have a knee joint here, which is the largest joint in the body, and we call this a hinge joint because it's like a hinge on your door where the knee can bend at this place. Now, it has a unique structure because it has bones. Now, the bone is a very hard substance, and to allow these bones to move without friction, there's a very soft rubbery thing which we call cartilage, and that lets these bones move on each other. So when you bend your knee, that allows it to move. To allow the movement, we have a lot of muscles around it, like the thigh muscles, the hamstring muscles, and to give stability, there are a lot of ligaments you can see on the sides. So this is the basic structure of this, and rheumatology and musculoskeletal diseases encompass about 200 different diseases which can affect the joints. So if you say joints, we have the knee, the spine, the shoulder, all of these joints have the same structure, and about 4 diseases are actually the commonest that we see involved in these joints.
And we'll go to those diseases very soon, but if I could just ask Dr. Panangala, what are the causes of rheumatic disorders? The most common ones that you see?
The most common rheumatic diseases we see, as Dr. Vijayasinghe said, the osteoarthritis, which we see in our day-to-day practice with various presentations like knee pain, backache, neck pain, all are related to this degenerative type of disease which comes with advancing age. So mostly the age-related causes are there. Then there are conditions like autoimmune conditions. We say you produce antibodies to your own body tissues, and there are different types of arthritis like rheumatoid arthritis, writers, ankylosing spondylitis, psoriatic arthritis. Those are all genetically determined autoimmune diseases. Then there are bacterial, viral and other causes giving rise to arthritis. Then following injuries and sports injuries or repetitive trauma, like conditions like shoulder capsulitis and sports injuries, sprains, ankle sprains, those are all related to these musculoskeletal diseases, or in other words rheumatism.
So actually even a sprain or a sports injury can be considered rheumatism, is it?
Yes, they all come under rheumatism, because rheumatism, as I said, was a very lay term, which like in Sinhalese they call it vati, so it doesn't really tell you anything about the disease.
So you really have to go in for an examination with a doctor and find out exactly what type of muscular and the joint disorder that you have, without just diagnosing it yourself as rheumatism or anything like that, is it? Because I mean, I think this is a misconception that I had, but I thought that rheumatism is just something that comes with age. But now you tell that there are so many causes, like viruses and bacterial infections and sports injuries, which is news to me as well. Alright, so if we get into the types that you were speaking about, the most common types of rheumatism, if we go to osteoarthritis, what is osteoarthritis? How do you define it? What's the difference between that and other types of rheumatism?
Osteoarthritis is where, as you said, the cartilage between the joints, you get wear and tear of it. It is usually a disease of aging, but you can get it with repetitive trauma, as Dr. Panangala mentioned. And in that, what you get is, commonly we see is osteoarthritis of the knee, the neck, and the spine.
I see. And so I think, sorry, you can go on, but I think we have some images as well. So they will also come up, but you go on, doctor.
Yes. And osteoarthritis of the knee comes with knee pain. Initially, you get the pain while you go up.
There we go.
I think Dr. Panangala can describe the images.
This picture I picked up from my last clinic. Actually, the lady came to me with severe knee pain, and you can see the deformity she had developed. And those are her X-rays. They are usually in a joint between those two bones. You get there's a space if you do a radiograph. But in that X-ray, there's no space at all. That means the cartilage is worn out completely. So this is called as advanced osteoarthritis, and the bones also get displaced, and there's abnormal shape. We call it bow legs or the varus deformity. These are all due to these arthritic changes in the weight bearing joints.
I see. But Dr. Arya Singh, now if you speak about bow legs, is it something to actually do with rheumatism? Because you see that in children as well, right? Toddlers and infants, you can see bow legs sometimes. So does that have a connection?
Actually, in children, small children, almost everybody, or maybe 90% of children have bow legs when they start walking. But by the time they're about 3 or 4, about 99% it goes off. So you need not worry if the child is only, say, less than 4 years. But if persists later on, you may have to change certain things, the way they walk and the adaptations in the shoes to correct it. But that's not really a problem. But the problem really starts when they develop bow legs in old age due to osteoarthritis.
And this is when the interventional treatments come in, I'm guessing. What type of treatment do you have for osteoarthritis?
I think actually about the pictures we saw were very advanced osteoarthritis. And in these diseases, the first sign you get is pain. And pain is actually a sign that there's something wrong inside your joint, and it's at that time that you should address the issue rather than waiting for you to develop something like bow legs and become advanced. So at the initial phase, it's very important to diagnose, and we're all rheumatologists, and rheumatology involves study the diagnosis and treatment of these diseases. And the diagnosis is very important, so it involves a history, taking the description from the patient, then examining the joint, and then imaging like X-rays or even advanced imaging like MRIs and blood tests. And after we come to that, we do few things. First thing is we relieve pain, because everybody comes with pain, and pain management is very important. Then the next step is prevent progression. As you see, we have to prevent this disease from progressing. And then the final step is actually making the patient better, preventing this from getting worse. So these are the steps that we use in managing these patients.
So all of these have to